So my name is Karami Reed, and I am currently working as a pharmacist at Shaver Pharmacy and Compounding Center in Pocatello, Idaho. So the reason we decided to sign up for the NCPA Innovation Center fellowship is because Shaver Pharmacy is a big pharmacy where we're trying to get things up and running. We're a community pharmacy where we have a whole bunch of different projects. And as a community pharmacy, we pride ourselves in kind of representing the river between both physicians here in Pocatello and independent pharmacy. So the NCPA fellowship became this amazing resource for us to be able to have the new perspectives that we needed to be able to bring new things to Pocatello. There were a few discussion topics that we specifically liked that specifically impacted our pharmacy. One of them, personally, we had one topic at the very beginning of the fellowship where we talked a lot about keeping a good culture in the pharmacy. And as a new hire, I worked for Shaver Pharmacy for 8 years in different positions. So as an actual pharmacist, it's a different position for me to be in charge. And they had a discussion about how to keep employees happy and to keep the culture in the pharmacy, happy and light, because pharmacy is not an easy job. It is hard to stay happy sometimes when there's patients yelling at you, people are happy. It's just long days on your feet. So that was one of the huge discussions that we had that kind of helped us, lighten the mood in our pharmacy and to keep things happier and to realize it's not the end of the world when things go wrong and there's things that we just can't control. But we can control, celebrations of birthdays, or we're happy that this person was able to show up to work today and to be able to celebrate those things. So that was a big perspective change that we did here in our pharmacy, which has helped a lot with the culture. So the NCPA Innovation Center CPESN Community Pharmacy Fellowship does a great job of finding guest speakers who are both experts in their individual fields and have lots of experience with teaching or showing how to implement their programs. That was a huge thing to me because it wasn't just someone teaching us for an hour or just sharing their opinions. It was definitely someone that had experience in teaching someone how to implement their programs, not just what it was. My favorite part of the fellowship was having access to other professional pharmacists who could help move our programs forward. And then we were also able to give them ideas of how to advance things. Like a huge topic right now was the COVID vaccines, and Pocatello, Idaho, we've been a big influence on the testing and the vaccines and things like that. So it was really nice to be able to share things with others and then to get feedback back from them as well. It was like we had one big team with a common goal. So we've had a few successes as a result of the fellowship. One of the big things I will say is that the fellowship has a lot of different topics. So as far as implementing everything at once, it takes some time. So you'll have to be patient with that, but trust me, you'll be working on it for years. But one of the things that we specifically have already implemented was it definitely helped us increase our resources of both materials and people available to help answer questions and to continue to move things forward. I don't know how many times now I've been able to email someone out in New York and ask them how they're implementing a diabetic program. And they've sent me materials and things like that. And they've helped us figure out billing codes. It's been huge to have those new resources. If I had a pharmacist ask me whether or not I would tell them to sign up for this fellowship, the biggest thing I would say is that it's well worth the money. I would definitely make sure you have an employee that can designate time to the fellowship because it's worth it. There's so much to learn and enough material given that you'll be able to continue growing your services and improving your business for years after the fellowship. It does seem to be super paced, which is why I would definitely designate someone to have that set apart time to participate in this. But it's worth the investment because as long as you're prepared to participate in these things, there's going to be huge changes in your pharmacy, all for the better, as long as we're all ready to make those necessary changes to keep improving.